The sirens screamed 3 blocks away before Metropolitan General Hospital even knew what was coming. Dr. Maya Reeves stood at the scrub sink on the 3rd floor, washing her hands with the same methodical precision she brought to everything. 34 years old, 2nd-year surgical resident. Auburn hair pulled back so tight it could pass military inspection, though no one here knew why that mattered. The water ran clear over her fingers. She counted to 20. Always 20. The overhead system crackled to life. All available trauma staff to emergency. Presidential motorcade inbound. ETA 2 minutes. Repeat. Presidential motorcade inbound. The surgical wing exploded into motion. Maya dried her hands, moved toward the stairs. Her body shifted into a different rhythm, one she'd buried 3 years ago, under textbooks and hospital protocols, and the fiction that she was just another resident learning to cut and suture. She reached the trauma bay in 90 seconds. Secret Service had already secured the entrance. Men in dark suits with earpieces, hands resting near concealed weapons, eyes scanning everything that moved. The hospital's chief of surgery, Dr. Bernard Whitmore, stood at the center giving orders, his silver hair perfectly styled even in chaos. Maya stepped through the outer perimeter. A hand caught her shoulder. Hard. "You're not authorized to be here, Doctor." Whitmore's voice carried across the corridor. "This requires senior staff only. Return to your assigned rotation." Maya met his eyes, didn't argue, just looked past him toward the trauma bay entrance where she could see the empty gurney, the monitoring equipment being prepped, the rapid infusion system set to maximum flow rate. "Dr. Whitmore, I'm trauma certified and I don't care what certification paperwork you filled out." His face flushed red. "The President of the United States is arriving with a gunshot wound. I need surgeons with experience, not second-years who think they belong in the room because they showed up. Get out." The other residents had stopped moving, watching. Maya's jaw tightened. She felt the old instinct rising, the one that said rank meant nothing when someone was bleeding out. But she wasn't Major Reeves anymore. She was a resident, bottom of the hierarchy. She stepped back, understood. Whitmore had already turned away, barking orders at the attending physicians clustering around him. Maya watched the organized chaos, saw the way they positioned themselves, noted the equipment they were pulling. Standard trauma protocol. By the book. Her pager vibrated against her hip. OR3. Routine cholecystectomy. Patient prepped and waiting. A gallbladder removal. Scheduled surgery. Routine as it got. She looked once more at the trauma bay, then walked toward the surgical wing. The motorcade arrived with the sound of screeching tires and shouted commands. Maya heard it from the scrub room adjacent to OR3. Heard the organized thunder of feet, the sharp voices of Secret Service coordinating with hospital security, the controlled urgency of trauma physicians receiving their patient. She turned on the water, began scrubbing again. Through the window, she could see her patient on the table. Margaret Chen, 62 years old, chronic cholecystitis, straightforward case. The kind of surgery residents did to build hours and confidence. The OR nurse, Tommy Rodriguez, pushed through the door. 40-something, former Army medic, though Maya only knew that from his efficient movements and the way he set up a surgical tray like he'd done it under mortar fire. "Crazy down there," Tommy said. "President took a bullet. Whole hospitals losing their minds." Maya nodded, kept scrubbing. "You weren't curious?" Everyone else tried to get a look. "I have a patient waiting." Tommy studied her for a moment. Something shifted in his expression. "Yeah, you do." She entered OR3 at exactly 2:34 p.m. Margaret Chen lay draped and prepped, already under anesthesia. The anesthesiologist, Dr. Patel, looked up from his monitors. "Ready when you are, Dr. Reeves." Maya positioned herself, looked at the surgical field, let her mind go quiet. Scalpel. The blade touched skin, clean incision, 4 movements to access the abdominal cavity. She could do this in her sleep, had done it in worse than sleep, had done it under fire, in the dark, with mortars impacting 50 meters away. But that was a different life. Retractor. Tommy's hands moved in sync with hers. No wasted motion, no hesitation. She exposed the gallbladder, chronically inflamed, as expected. Began the dissection to identify the cystic duct and artery, then stopped. The tissue wasn't right. The inflammation pattern was wrong. She palpated the area, Felt resistance where there shouldn't be any. Tommy increased suction. He complied. Maya extended the incision slightly, got better visualization. Her mind cataloged what she was seeing in half a second. Merizzi syndrome. Rare complication. The gallbladder had eroded into the common bile duct, creating a fistula. The preoperative imaging had missed it because whoever read the scan wasn't looking for something this uncommon. If she followed the standard cholecystectomy protocol, Margaret Chen would develop septic shock within 6 hours. Mortality rate over 40%. Maya reached for her phone with one sterile gloved hand. Calling Dr. Whitmore. The line rang 4 times. Picked up to the sound of controlled chaos. What? Whitmore's voice was sharp. Dr. Reeves in OR3. My cholecystectomy patient has Merizzi syndrome with probable cholecystoenteric fistula. I need authorization to extend the procedure to hepatobiliary reconstruction. Silence. Then, you're calling me during a presidential trauma to ask about a gallbladder? The patient will go septic if. Follow standard protocol, Dr. Reeds. Close if you can't handle a routine cholecystectomy. I don't have time for this. The line went dead. Tommy looked at her across the table. What are you going to do? Maya stared at the surgical field, at the inflamed tissue and tea. He hidden fistula that would kill her patient if she walked away. She thought about protocols, about hierarchies, about staying in her lane. Then she thought about the oath she took, the real one, the one that said do no harm, even when it meant breaking rules made by people who weren't standing at this table. Hand me the fine dissection kit, Maya said. We're fixing this properly. Her hands moved without hesitation. Muscle memory from 600 surgeries in 8 years. Different wars, same principle. Save the life in front of you. The monitors beeped steady behind her. Margaret Chen's heart beat strong and regular. Maya worked. If you want to see how Maya goes from dismissed resident to the only person who can save a president's life, make sure you subscribe to Emergency Heroes Stories. Where are you watching from? Because what happens in the next 40 minutes will change everything you think about credentials versus experience. The residents' locker room smelled like antiseptic and burnt coffee. Dr. Lisa Park sat on the wooden bench, still in her scrubs, phone in hand. Around her, 3 other residents clustered near the lockers, voices low but animated. Did you see Reeves try to get into the presidential trauma? Lisa said. Whitmore shut her down in front of everyone. Can you blame him? Marcus Wedd pulled off his surgical cap. She's been here 8 months and barely says 10 words. No social life, no personality. Just shows up, operates, and leaves. Her technique is perfect, though. This from Jennifer Oakes, first-year resident, still intimidated by everything. I watched her do an appendectomy last week. Fastest I've ever seen. Textbook perfect, Narcus agreed. Like she memorized every movement from surgical videos. But there's no instinct. No improvisation, just robotic execution. Lisa scrolled through her phone. I heard she applied here from nowhere. No letters of recommendation from surgical attendings. No research publications. Just test scores and some vague credentials. Maybe she studied really hard, Jennifer offered. Nobody learns to suture like that from studying. Marcus stood, stretched. I've been doing this 2 years longer than her, and my knots still don't look that clean. You think she cheated somehow? Lisa asked. I think she's hiding something. The locker room door swung open. Tommy Rodriguez walked in, heading for his locker. The conversation died. He grabbed his jacket, looked at the residents, shook his head slightly. You all should be more worried about learning than gossiping. We're just saying she's unusual, Lisa said defensively. Unusual how? Because she's competent? Tommy's voice carried an edge. I've worked with hundreds of residents. Most of you panic when something goes wrong. She doesn't. That's not robotic. That's discipline. He walked out before anyone could respond. Marcus waited until the door closed. Former military guy defending the quiet, mysterious surgeon. How predictable. But Jennifer was frowning. What if he's right, though? What if we're just jealous? Of what? Lisa locked her phone. She does her cases and goes home. No conferences, no networking. She's going nowhere in this field. Down in OR3, Maya was going somewhere very specific. The cholecystoenteric fistula lay exposed under the surgical lights. The erosion between the gallbladder and the bile duct was worse than she'd initially assessed. The surrounding tissue showed early signs of infection. This wasn't a complication. This was a ticking bomb. Suction, Maya said quietly. Tommy cleared the field. Dr. Patel monitored the anesthesia, occasionally glancing over his drape to watch Maya work. She'd made the decision. Now she had to execute. The hepatobiliary reconstruction required techniques most second-year residents hadn't seen, let alone performed. Maya's hands moved through the steps like she was following a map only she could see. Identify the fistula margins, debride the infected tissue, isolate the common bile duct, prepare the repair. Her sutures were unusual. Interrupted pattern instead of continuous. Stronger, more secure. The kind of closure you used when you knew the patient might not have access to follow-up care. When the repair had to hold no matter what. Military field surgery adaptation, Tommy noticed. He'd noticed a lot of things about Maya Reeves over the past 8 months. The way she assessed a patient in under 10 seconds. The way she never wasted movement. The way her hands stayed steady when everyone else's shook. He'd seen those patterns before, in Kandahar, in field hospitals where surgeons operated in 100-degree heat, with mortars impacting close enough to rattle instruments. That's an interesting suture pattern, he said carefully. Maya didn't look up. It's stronger. Where'd you learn it? Textbook. Which textbook? She didn't answer, just kept working. The reconstruction took shape. Tissue planes aligned. Blood supply preserved. The fistula closed and reinforced. Dr. Oven. Patel checked his watch. How much longer? 20 minutes, Maya said. She finished in 18. The final suture went in at 3:12 p.m. 38 minutes total from initial incision to closure. A standard cholecystectomy took 45 minutes to an hour. What Maya had just performed, identifying a rare complication, converting to a complex hepatobiliary reconstruction, and completing it without a single wasted movement, should have taken 3 hours minimum. Dr. Oven. Patel stared at the surgical site. That was remarkable. Maya stripped off her gloves. Patient stable. Standard post-op recovery protocol. I'll check on her in an hour. She walked out of the OR before anyone could ask questions. In the scrub room, she stood at the sink. Let the water run over her hands. Watched the soap disappear down the drain. Her pager vibrated. Dr. Whitmore's office. Immediately. Maya dried her hands. Walked through the surgical wing toward the administrative corridor. Staff passed her without acknowledgement. She was invisible here. Just another resident in generic scrubs. Exactly what she'd wanted when she'd applied 3 years ago. Whitmore's office door was open. He sat behind his desk, still in his surgical cap, face tight with exhaustion. Sit, he said without looking up. Maya remained standing. He finally raised his eyes. I got a call from Dr. Patel. He says you performed a hepatobiliary reconstruction without authorization. The patient had Marizzi syndrome with... I know what the patient had. I read the operative report you filed 10 minutes ago. He leaned back in his chair. What I want to know is where a second-year resident learned to identify and repair a condition most senior surgeons would miss. I study extensively. That's not an answer. Maya met his gaze, didn't blink. The patient will make a full recovery. 0 complications. Pathology will confirm the diagnosis. That's not the point. Then what is the point? Whitmore stood, walked around the desk, studied her like she was a specimen he couldn't quite classify. You've been here 8 months, he said slowly. In that time, you've performed 43 surgeries. Every single one perfect. No complications, no errors. Times that are statistically impossible for your experience level. Maya said nothing. Your suture technique isn't standard. Where dissection methods aren't what we teach. Your speed suggests muscle memory that takes years to develop. He crossed his arms. So I'll ask again, where did you learn? I prepare extensively for every case. Preparation doesn't explain what I'm seeing. Before Maya could respond, the overhead system crackled to life. Code Blue, Trauma 1. All available surgical staff report immediately. Code Blue, Trauma 1. Whitmore's face went pale. He grabbed his surgical cap and ran. Maya stood in the empty office for 3 seconds. Then followed. the president was crashing, and every instinct Maya had spent 3 years suppressing suddenly roared back to life. Maya reached Trauma 1 20 seconds after Whitmore. The scene inside was controlled chaos. President James Bradford lay on the trauma gurney, surrounded by 6 physicians, 4 nurses, and 5 Secret Service agents pressed against the walls. Monitoring equipment screamed alerts. Someone called out vitals in sharp click tones. BP 90/50 and dropping. Heart rate 130. Oxygen sat 88%. Maya stayed near the door, watched. Dr. Whitmore stood at the patient's right side, hands already moving. "Get me a chest x-ray, now. And where's cardiothoracic? We need them here 5 minutes ago." The portable x-ray machine rolled in. Everyone stepped back. The image appeared on the monitor. Maya saw it immediately. The bullet fragment sat lodged near the right atrium, but the angle was wrong. The entry wound trajectory didn't match the fragment's current position, which meant it had migrated, still moving, working its way closer to the heart with every beat. Cardiac tamponade was starting. Blood filling the pericardial sac. Pressure building. The heart couldn't pump effectively. Minutes until complete failure. "Fragments stable," one of the trauma surgeons said, studying the x-ray. "We need to get him to OR, open him up, and extract under direct visualization." Agreed. Whitmore turned to the circulating nurse. "Prep OR1, full cardiothoracic setup. Call in the cardiac team." "They're 20 minutes out," someone said. "Traffic from the motorcade closure." "Then we wait 20 minutes. We're not opening his chest without proper support." Maya's hands flexed at her sides. 20 minutes. The fragment would reach the heart wall in less than 15. She could see it on the monitor, could calculate the trajectory, could read the rhythm on the EKG showing the early signs of electrical disruption. She'd seen this before. Kabul, provincial governor, assassination attempt, different weapon, same injury pattern. That patient had died because they'd waited. Tommy Rodriguez moved past her, carrying additional IV supplies. He saw her face, stopped. "You see something," he said quietly. Not a question. Maya didn't answer, just kept watching the monitors. President Bradford's oxygen saturation dropped to 85%. "Increase O2 to 15 liters, Whitmore ordered. "And somebody get me an ETA on that cardiac team. 18 minutes now." Maya took one step forward. A hand caught her arm. Secret Service agent. Tall, Asian American, early 40s. His grip was firm but not aggressive. "You need to stay back," he said. Maya looked at him, then at his hands. Scars across the knuckles, faded but distinct. The kind you got from fast roping out of helicopters in desert conditions. The callus pattern on his right index finger, specific to certain military firearms. Former special operations. Army, probably. Rangers or maybe 75th. She met his eyes. He studied her face. Something flickered in his expression. Recognition trying to surface through memory. "Do I know you?" he asked. No, but his grip loosened slightly. He was still looking at her hands now, at the way she stood. Weight balanced, ready to move in any direction. The posture wasn't medical, it was tactical. "What's your name?" he asked. "Dr. Reeves, second-year resident." On the monitors, President Bradford's heart rate jumped to 140. "Fragments definitely migrating," one of the surgeons said. "We need to move now." "Not without cardiac backup," Whitmore snapped. "We open his chest without proper support and he dies on the table. He might die before they get here. Then we manage him conservatively until—" The monitors screamed. The president's blood pressure dropped to 70/40. Maya moved, not into the room, just shifted her weight. The agent's hand tightened on her arm again, but he was watching her face. "You've seen this before," he said quietly. It wasn't a question this time either. Maya's jaw clenched. "Yes." "Where?" She didn't answer. The president's oxygen saturation hit 82%. His skin was taking on a grayish cast, mottled. The look of a body starting to shut down. Whitmore was on the phone now, yelling at someone about the cardiac team. The other surgeons stood around the gurney, hands ready but uncertain. Everyone knew what needed to happen. No one wanted to make the call without backup. Medical politics, liability, cover your ass medicine. People died while doctors worried about lawsuits. "Cardiac team is stuck," Whitmore said, lowering the phone. His face had gone pale. "Major accident on the freeway. They're rerouting. 45 minutes minimum." The room went silent. "We have to open him," one of the trauma surgeons said. "Without cardiac backup, without proper visualization equipment, he'll be dead in 45 minutes. Whitmore looked at the monitors, at the president's deteriorating vitals, at the fragment on the X-ray that was definitely, unmistakably, moving closer to the heart. "Prep him," Whitmore said finally. "We'll do it here, in trauma. We don't have time to move him to OR." The team exploded into motion. Instruments appeared, sterile drapes. Someone poured betadine across the president's chest. Maya watched Whitmore's hands, saw the slight tremor, saw the way he kept looking at the X-ray, trying to map the approach, calculating angles and risks. He was competent, experienced, but he'd never done this specific extraction. She could tell by the way he positioned himself, by the incision line he was planning. Standard thoracotomy approach, safe, by the book. Also wrong. The fragment's position required a modified approach. Subcostal entry with pericardial window. Faster access, less tissue trauma. Lower risk of hitting the fragment during the dissection. She'd done it twice, once successfully. The Secret Service agent was still watching her. "You know how to do this," he said. "I'm a second-year resident." "That's not what I asked." On the table, President Bradford's eyes fluttered open, conscious but fading. His lips moved. No sound came out. The agent leaned closer. "Mr. President?" The president's eyes found Maya, locked on her face. He saw something, maybe the certainty, maybe the calm, maybe just the only person in the room who didn't look terrified. His lips moved again. This time sound came. Barely a whisper. "Let her." Everyone froze. Whitmore looked up from this prep. "Mr. President, she's not qualified to. Let her work." Each word cost him. His oxygen sat was 80 now. "I can see it. Let her work." The room held its breath. Whitmore stared at Maya. "You can't possibly." "She can." Tommy Rodriguez spoke from the equipment cart. "I don't know how, but she can." The Secret Service agent released Maya's arm, stepped back, nodded once. Maya moved to the table. Her hands were steady. Her breathing was controlled. Her mind shifted into the space she'd lived in for 8 years. The place where nothing existed except the patient, the problem, and the solution. She looked at Whitmore. "I need a number 10 scalpel, a rib spreader, needle nose forceps, and irrigation. I'll need someone on suction who doesn't hesitate. And I need everyone else to be completely silent." Whitmore stared at her for 5 full seconds, then stepped aside. "Give her what she needs." Maya positioned herself at the president's right side, looked at the monitor one more time, calculated the angle, the depth, the approach. Scalpel, the blade touched skin, and Maya Reeves stopped being a second-year resident. The incision was different from what anyone expected. Maya cut subcostally, below the ribcage, a path that avoided the standard thoracotomy approach and gave her direct access to the pericardial space, without having to spread ribs or navigate through lung tissue. Sealed surgery technique. Faster, less traumatic. Designed for situations where you didn't have time for textbook approaches. Retractor. Tommy handed it to her. Their movements synchronized instantly. He'd seen combat surgeons work before, recognized the rhythm. Maya exposed the pericardium. The membranous sac around the heart was bulging, tense, filled with blood from the migrating fragment that was tearing microscopic vessels as it moved. "I'm creating a pericardial window," Maya said. Her voice was different now. Calm but commanding. The voice of someone who'd done this in worse conditions than a well-lit trauma bay. "When I open this, blood will evacuate rapidly. Suction needs to be immediate and continuous." "Ready," Tommy confirmed. Maya made the cut. Blood poured out. Dark, venous. Tommy's suction caught it instantly. The pericardial pressure released. On the monitors, President Bradford's blood pressure ticked up 5 points. "Good," Maya said. Irrigation. Warm saline flooded the field. She cleared it, got visualization of the heart surface. The fragments sat against the right atrial wall. Small, maybe 5 millimeters, irregular edges. Still moving with each heartbeat, abrading the muscle. One more beat in the wrong direction and it would puncture through. The room was silent except for the monitors and the suction. Maya extended her left hand. Needle nose forceps. The instrument touched her palm. She didn't look away from the surgical field. Her right hand stabilized the heart. Her left hand moved the forceps in. Slow, precise, reading the rhythm. waiting for the moment between beats when the fragment would be most accessible. The Secret Service agent watched from 3 feet away. His eyes were locked on Maya's hands, on the way she moved, the absolute certainty in every gesture. He'd seen hands like that before. "Wait," he said suddenly. Maya didn't stop, didn't look up. "If you're going to speak, say something useful or be quiet." Her tone wasn't rude, just factual. The tone of someone who couldn't afford distraction. The agent pulled out his phone, started scrolling. Fast. Maya's forceps touched the fragment. She felt the resistance. Tested it. The metal piece had embedded slightly in the myocardial tissue. Not deep, but enough that pulling it straight out would tear muscle and potentially create a larger bleed. She needed to rotate it first, work it free, like removing a splinter. "This will take 90 seconds, Maya said. "His pressure will drop when I mobilize the fragment. Be ready with vasopressors." One of the nurses prepared the medication. Maya began the extraction. Rotate. Lift. Pause. Let the tissue relax. Rotate again. The fragment shifted. President Bradford's blood pressure dropped to 70/30. "Vasopressors going in," the nurse called. Maya kept working. The fragment was coming free, millimeter by millimeter. The agent found what he was looking for on his phone. A photograph, 3 years old. Military Field Hospital, Kandahar Province. A female surgeon in combat fatigues. Face partially obscured by surgical mask and protective eyewear. But the eyes were visible. Green, intense, focused on a patient in front of her. The same eyes he was looking at right now. "Major Reeves," the agent said quietly. Maya's hands didn't stop moving. But something changed in her posture. A tension that wasn't there before. "You're mistaken. Kandahar, 2019. You operated on 9 soldiers from my unit after an IED ambush. Saved all 9. 3 of them shouldn't have survived the transport to you." The fragment came free. Maya lifted it out, placed it in the specimen tray, immediately inspected the extraction site for bleeding. Minor oozing, nothing catastrophic. Irrigation. Tani flushed the field. Maya cauterized 2 small vessels. The bleeding stopped. President Bradford's pressure climbed back to 85/50. "Cardiac rhythm is stabilizing," Dr. Patel announced from anesthesia. Maya checked the pericardial space. No additional fluid accumulation. No signs of continued bleeding. The heart muscle looked intact. She placed a temporary drain. Started closing the pericardial window. The agent stepped closer. "Your name was never in official records. They listed you as classified personnel. But I remember your voice. The way you talked us through moving the wounded. You told my sergeant to stop praying and start applying pressure." Maya's sutures were rapid, precise. The muscle memory of someone who'd closed hundreds of surgical sites under time pressure. "He lived because he applied pressure," the agent continued. "They all lived because you refused to accept that they were too far gone." Whitmore stood frozen. Watching Maya work, watching the monitors showing a patient who'd been minutes from death, now stabilizing. "Who are you?" he asked. Maya tied off the final suture on the pericardial closure, started on the subcostal incision. "Dr. Maya Reeves, 2nd-year surgical resident, as I've said." That's not a complete answer. It's the only answer that matters right now. She finished the closure, dressed the wound, stepped back from the table. President Bradford's vitals were stable. Blood pressure 95/60, heart rate 100 and dropping, oxygen saturation 94% and climbing. The fragment sat in the specimen tray, small, innocuous, the piece of metal that had nearly killed the President of the United States. Maya stripped off her gloves. "He needs ICU monitoring for 24 hours. Watch for pericardial effusion or arrhythmias. Chest X-ray in 6 hours to confirm no pneumothorax. Standard post-cardiac trauma protocols." She turned to leave. "Stop." Whitmore's voice was sharp. "You don't just walk away after that." Maya looked at him. "The patient is stable. You have a full team here. I have post-op checks on my other patient. Margaret Chen can wait. We need to discuss what just happened." A bullet fragment was extracted. The president will recover. What's there to discuss? The Secret Service agent moved between Maya and the door, not blocking, just positioning himself where she'd have to acknowledge him. Major Maya Reeves, he said clearly. U.S. Army Special Operations Command, combat surgeon, 8 years active duty, 12 deployments, Silver Star recipient for actions in Kandahar, where you extracted 9 wounded soldiers under direct fire and performed emergency surgery in an unsecured location. The room went completely silent. Every person stared at Maya. She met the agent's eyes. Her expression was unreadable. That's classified information. I was there. I'm Agent Marcus Chen. I was the sergeant you told to stop praying. Maya's jaw tightened. For the first time since she'd entered the room, her absolute control wavered. Then you know I left that life behind. Why? That's not your concern. It is when you just saved the president's life, using techniques that aren't taught in any civilian medical program. Chen pulled out his badge, showed it to her. And when the president personally asks to speak with his surgeon, I need to know exactly who she is. President Bradford's eyes were open now, watching Maya. His voice was weak but clear. I'd like to know too. Maya looked at the president, at Chen, at Whitmore and Tommy and the assembled medical staff. At all the people who suddenly wanted answers she'd spent 3 years avoiding. I'm a resident, she said quietly. That's all I am now. That's not all you are. Chen's voice was gentle but firm. And I think you know that. The overhead system crackled. Trauma alert. Multi-vehicle collision on Interstate 95. Mass casualty event. 15 patients inbound. All available personnel report to emergency. Maya looked toward the door, then back at the president. We're not done here, Whitmore said. Yes, we are. Maya moved past Chen. People are dying. She walked out of Trauma 1. Behind her, Chen pulled out his phone again. Started making calls, because Maya Reeves might want to hide. But the woman who just saved the president's life wasn't someone who could stay hidden anymore. The emergency department transformed into controlled chaos in under 3 minutes. 15 patients from a multi-vehicle collision. 4 critical, 7 serious, 4 minor. The triage nurse called out classifications as ambulances screamed into the bay. Maya moved through the organize. Ed Mayhem grabbed a trauma gown, tied it without looking. Lisa Park appeared at her elbow, eyes wide, voice uncertain. Is it true what they're saying about you? Maya didn't answer, just moved toward Trauma 2, where the first critical patient was arriving. They're saying you saved the president, that you're some kind of military surgeon, that. Focus on your patient, Dr. Park. Lisa fell silent, but she didn't leave, just watched Maya with an expression caught between awe and resentment. The first gurney crashed through the doors. Male, mid-30s, steering column impaction, chest trauma, labored breathing. Maya assessed in 3 seconds. Tension pneumothorax, left side. The lung had collapsed and air was building up in the pleural space. Pressure increasing. Heart and major vessels being compressed. Fatal in minutes without intervention. I need a 14-gauge needle, antiseptic, and local anesthetic, Maya said to the nearest nurse. Shouldn't we get X-ray confirmation first? Lisa asked. He'll be dead before the portable arrives. Hold his arm. Maya palpated the chest, found the second intercostal space, mid-clavicular line. The anatomical landmark every medical student learned, but few residents had actually performed in emergency situations. She prepped the site, inserted the needle. The hiss of escaping air was immediate. Pressure released. The patient's oxygen saturation jumped from 79 to 88% in seconds. Get chest tube set up, Maya said. He needs proper drainage and OR for internal injuries. She moved to the next bay before anyone could respond. Agent Chen appeared in her peripheral vision, following at a distance, not interfering, just watching. The second critical patient was a woman, late 20s, massive facial trauma, airway compromised, blood pouring from nose and mouth. I need a cricothyrotomy kit, Maya said. The attending physician, Dr. Richard Foster, pushed forward. I'll handle this one. He positioned himself at the patient's head, tried to intubate through the mouth, failed. The anatomy was too distorted, too much blood. We need a surgical airway, Maya said. She's not getting oxygen. I can get the tube. Foster tried again, failed, again. The patient's oxygen saturation dropped to 65%. Maya moved, didn't ask permission, just took the scalpel from the instrument tray, and positioned herself at the patient's neck. "What are you doing?" Foster demanded. "Saving her life. Move." She didn't wait for him to comply, just made the incision, identified the cricothyroid membrane, cut through, inserted the tube in one smooth motion. Bag valve mask attached. Air flowed. The patient's saturation climbed. 70, 80, 85. Foster stared. That was completely inappropriate. You don't override an attending physician. Maya was already moving to the next patient. "File a complaint." Chen caught up with her outside trauma 4, grabbed her arm gently but firmly. "We need to talk." "I'm busy." "Maya." He used her first name. "I know what you're doing. You're running. Same thing you did 3 years ago when you left the army." She stopped, turned to face him. Her green eyes were cold. "You don't know anything about why I left." "Then tell me." "No, the president wants to thank you personally. The hospital is going to want an explanation. The media is going to find out you saved his life. You can't hide anymore. Watch me." She pulled free, walked into trauma 4. A teenage boy lay on the gurney, 16, maybe 17. Seatbelt injury across abdomen, pale, diaphoretic, blood pressure dropping, internal bleeding, probably splenic rupture. "He needs surgery immediately," Maya told the trauma team. "Prep OR 2. "All ORs are full," someone said. "We're waiting for them to finish the appendectomy in 3. "How long?" 20 minutes. Maya looked at the boy's monitors. Blood pressure 70/40. Heart rate 140. He didn't have 20 minutes. She turned to Chen. "You want to talk? Fine. Get me an OR. Use your presidential authority or whatever clearance you have. Get me a room in the next 5 minutes or this kid dies." Chen pulled out his phone. "Made a call." His voice was calm, but carried absolute authority. "This is Special Agent Marcus Chen, Presidential Protection Detail. I need OR access for emergency surgery. Override all current scheduling. Authorization code Alpha 79er Victor." He listened, nodded. "OR 1 is clearing now," he told Maya. "You have 8 minutes." Maya was already moving. "Get him prepped. Type and cross for 6 units. Call anesthesia." The gurney rolled toward the surgical wing. Maya walked alongside. Chen matched her pace. "Kandahar," he said quietly. 3 years ago. The convoy ambush. Something happened there that made you leave." Maya's hands checked the boy's IV lines, adjusted the flow rate. Didn't look at Chen. "I'm not discussing this. You saved 9 lives that day, but you lost 3. I read the after-action report. Classified, but I have access. 3 patients died during transport. You blamed yourself. I said I'm not discussing this. The report said you were exonerated, that the deaths were due to combat conditions beyond your control, that you performed above and beyond any reasonable standard." Maya stopped walking. The gurney continued ahead. She turned to face Chen directly. "The report was wrong." "How?" "Those 3 soldiers died because I made the wrong call. I prioritized the wrong patient. I was operating on someone I thought could be saved, while 3 others bled out 50 meters away. By the time I got to them, it was too late." Her voice was flat, emotionless, the tone of someone reciting facts she'd repeated to herself 1,000 times. "I came here to learn civilian medicine, to work on patients who aren't bleeding out from gunshot wounds and IED fragments, to operate in clean rooms with proper equipment and backup, to be a normal doctor." "You're not a normal doctor," Chen said gently. "You never were. That's not your decision." "No, but it's reality." He gestured toward the ER behind them. "You just saved 4 people in 15 minutes. Used techniques no one else here knows. Made decisions that attendings with 20 years' experience hesitated on. That's who you are." Maya's jaw clenched. "That's who I was." "You don't get to choose. The talent is part of you." Before she could respond, Dr. Whitmore appeared. His face was flushed. His surgical cap was askew. He looked like a man whose entire worldview had been shattered in the past hour. "Dr. Reeves, my office, now. I have surgery in 6 minutes. Then this will be brief." Whitmore's voice carried an edge Maya hadn't heard before. Not anger, something else. Uncertainty. "Agent Chen, you can join us." They walked to Whitmore's office in silence. The door closed behind them. Whitmore sat heavily behind his desk, pulled up files on his computer, turned the monitor so Maya could see. Military service records, heavily redacted, but enough visible to tell the story. Major Maya Reeves, U.S. Army Medical Corps, Special Operations Command. 8 years active duty. 12 combat deployments. Over 600 surgical procedures performed in field conditions. Survival rate 94%. 3 commendations for valor. 1 silver star. And the final entry. Resignation accepted. Honorable discharge. No explanation given. I had to call in favors to access these. Whitmore said. Most of it is classified, but the basics are clear. You're one of the most experienced combat surgeons in the country. You have more trauma experience than anyone on my staff, and you've been working as a second-year resident for 8 months. Maya said nothing. Why? Personal reasons. That's not an answer. It's the only one you're getting. Whitmore leaned forward. The President of the United States is alive because of you. That child in the ER is about to be alive because of you. 4 other patients today are alive because of you. You have a gift that people desperately need. I also have a history of making mistakes that cost lives. 3 deaths in 600 surgeries. Whitmore's voice was firm. That's a 99.5% survival rate in combat conditions. Surgeons in civilian hospitals don't achieve those numbers. It should have been 600. The room fell silent. Chen spoke quietly. You're human, not perfect. No surgeon saves everyone. Maya looked at him. Her eyes were hollow. The 3 I lost weren't random. They were preventable, and they haunt me every single day. Whitmore stood, walked around the desk, stood directly in front of Maya. I'm offering you a position. Chief of Trauma Surgery. Full privileges, immediate appointment. Maya shook her head. I came here to finish my residency, to learn civilian medicine. You don't need to learn. You need to teach. No. Maya. The office door burst open. Tommy Rodriguez. His face was pale. The kid in OR1. He's crashing. Anesthesia can't stabilize him. They need you now. Maya was already moving. Behind her, Whitmore called out. This conversation isn't over. But Maya was gone, running toward the one thing she understood. The operating room. The patient. The crisis that required her to be exactly who she'd tried so hard to stop being. Maya pushed through the OR doors, already pulling on sterile gloves. The 16-year-old boy lay on the table. His name was David Chen. No relation to Agent Chen. Just a kid who'd been driving to soccer practice when a drunk driver crossed the median. The monitors screamed. Blood pressure 50/30. Heart rate 170. The numbers of someone dying. Dr. Foster stood at the table, hands inside the open abdomen, face pale. I can't find the source, he said. His voice carried an edge of panic. The spleen's ruptured, but I've got that controlled. There's bleeding from somewhere else. It's filling faster than I can evacuate. Maya moved to the table, looked into the surgical field. Blood, dark, venous, pooling faster than suction could clear it. Her mind cataloged possibilities in 2 seconds. Splenic injury was obvious. But the volume and color suggested a second source. Retroperitoneal, behind the abdominal organs. The hardest area to access and control. Retract the bowel, Maya said. Left side, pull everything medial. Foster hesitated. That's not standard protocol for splenic. Do it now or he dies on this table. Foster moved, retracted the intestines, exposed the retroperitoneal space. There, the left renal vein, torn, pouring blood into the cavity. Kidney injury from seatbelt compression. The impact had sheared the vein partially. Every heartbeat pumped more blood into the abdomen. I need vascular clamps, 2 of them, and Proline suture 4-0. The scrub nurse's hands were shaking as she passed instruments. Maya's hands weren't shaking at all. She placed the clamps, isolated the torn section. The bleeding stopped temporarily. David's blood pressure ticked up 5 points, 55/35. Still critical, still dying, but slower. He needs blood, Maya said. Push 2 units now, and get me better light. I can't see the vessel margins. The OR lights repositioned. The field became clear. The tear was 3 millimeters, jagged edges. The vein wall was thin, fragile. One wrong move and the whole thing would rupture completely. Maya had repaired worse, in a tent, in the dark, with mortar rounds impacting close enough to make the instruments rattle. But that was a different life. Her hands moved into position. The door opened. Agent Chen entered, followed by Dr. Whitmore. They stayed near the wall, watching. Start the repair, Whitmore said quietly. We're just observing. Maya began the suture. Each stitch had to be perfect. Enough tension to close the tear. Not so much that the tissue tore further. Her hands moved with the precision of 600 previous surgeries. Muscle memory, pattern recognition, the ability to work in millimeters while the patient's life measured in seconds. Blood pressure, 60. Over 40. The anesthesiologist called out. Better. Not good, but better. Maya placed the fourth stitch. The tear was closing. The vessel walls were holding. Behind her, Chen spoke quietly to Whitmore. I've seen trauma surgeons work for 20 years. I've never seen anyone move like that. Neither have I, Whitmore admitted. Maya placed the sixth stitch. The repair was nearly complete. You asked why I left, she said suddenly. Her eyes never left the surgical field. Kandahar, 3 years ago. Convoy ambush. 9 wounded came in simultaneously. 3 were critical. 6 were serious but stable. Her hands continued working. Stitch 7. Stitch 8. I made a decision. Prioritized the patient with the best chance of survival. Spent 18 minutes on a tension pneumothorax and hemorrhagic shock. Stabilized him. Perfect outcome. Stitch 9. While I was working, the 3 critical patients were with my medics. Less experienced. They did everything right, but it wasn't enough. By the time I got to them, 2 were already gone. The 3rd died while I was operating. Stitch 10. The repair was complete. After-action review said I made the right call, that the 3 critical patients were non-survivable, that I saved the maximum number possible given the circumstances. She removed the clamps, watched the repaired vessel. No bleeding. The sutures held. I knew they were wrong. I'd seen injuries like that before. I could have saved at least 1 of them, maybe 2, if I'd prioritized differently. David's blood pressure climbed to 70/45. Maya moved to the splenic injury, began the repair there. Her voice remained flat, emotionless, the tone of someone reciting a confession they'd rehearsed 1,000 times. The 3 soldiers who died were 19, 21, and 23 years old. Their names were Jackson, Rodriguez, and Kim. Jackson had a daughter he'd never met. Rodriguez was getting married in 2 months. Kim was pre-med, wanted to be a surgeon. She ligated the splenic artery, began removing the damaged organ. The spleen wasn't salvageable, but David would survive without it. I came here to learn medicine without those decisions, to work on patients who arrive one at a time, with proper equipment, with backup, where I don't have to choose who lives and who dies based on resource allocation. The splenectomy was complete. She irrigated the abdomen, checked for additional bleeding. Everything was controlled. But you're still making those decisions, Chen said quietly. In the ER, tension pneumothorax, surgical airway, you prioritized and acted, same as Kandahar. That was different. How? Maya began closing, layer by layer. Fascia, subcutaneous tissue, skin. Because no one died today. Because you were here, Whitmore said. If you hadn't been, that woman with the facial trauma would have died. David here would have died, possibly others. Maya tied off the final suture, stepped back from the table. David's vitals were stable. Blood pressure 85/55. Heart rate 110. Oxygen saturation 96%. Post-op ICU, Maya said to the circulating nurse. Monitor for compartment syndrome and renal function. He'll need imaging in 6 hours to confirm kidney viability. She stripped off her gloves, her gown, stood in her scrubs exhausted. The OR door opened again. A woman entered. 58 years old. 2 stars on her collar. Brigadier General's uniform. Gray hair cut military short. Eyes that had seen combat and commanded respect. Whitmore straightened. General, we weren't expecting. Agent Chen called me. The general's voice carried absolute authority. Said Major Reeves was here. Maya's entire body went rigid. General Caldwell. Major. Caldwell walked across the OR. Stopped 3 feet from Maya. Or should I say Dr. Reeves now? I'm not a major anymore. You'll always be a major to me. Caldwell pulled a folder from under her arm. Classified markings. Top secret stamps. We need to talk about Kandahar. Maya's face was pale. There's nothing to discuss. Yes, there is. Caldwell opened the folder, pulled out documents. The after-action report you read was incomplete, redacted. The full investigation was classified above your clearance level. She handed the papers to Maya. Maya took them, started reading. Her hands began to shake. The convoy ambush was deliberate, Caldwell said quietly. Set up by a corrupt supply officer you'd reported 3 weeks earlier, for selling medical supplies on the black market. He arranged the ambush, compromised the route, ensured maximum casualties. Maya's eyes moved across the pages. Official investigation findings, court-martial proceedings, testimony from intelligence sources. The 3 soldiers who died were targeted specifically. Their vehicle was hit first, with armor-piercing rounds not available to local insurgents. They were dead before they reached you. Maya looked up. Her eyes were wet. The report said, "The report you saw was sanitized. Political protection. The supply officer had connections. The full truth was buried to avoid embarrassment." Caldwell's voice was firm but gentle. "You didn't make the wrong call, Maya. You never had a chance to save them. And the 6 you did save only survived because of your prioritization. You made the only correct decision possible." The room was silent except for the monitors beeping David's stable heartbeat. Maya stared at the documents. 3 years of guilt. 3 years of believing she'd failed. 3 years of running from who she was. All based on a lie. "Why are you telling me this now?" Her voice was barely a whisper. "Because you saved the president's life today. Because that's going to be news. And because you deserve to know the truth before the world starts asking questions." Caldwell stepped closer. "You were one of my best surgeons, Maya. You left because you thought you'd failed. I'm here to tell you that you never did." Maya's hands were still shaking. 3 people died. 3 soldiers were new. Ordered by a traitor, you saved 9 others who would have died without you. Stop carrying guilt that was never yours to carry. Whitmore moved forward. "The offer stands. Chief of Trauma Surgery, full authority. You can build a program, train others, save more lives." Maya looked at David Chen on the table. 16 years old, alive, going to play soccer again. Looked at the documents in her hands, the truth she'd never known. Looked at Caldwell, at Chen, at Whitmore, at Tommy Rodriguez standing near the door, waiting to see what she'd decide. "If I accept," Maya said slowly, "I do it my way. Combat trauma protocols, aggressive intervention, no hesitation, no politics." "Agreed," Whitmore said immediately. "And I want a program for veterans transitioning to civilian medicine, combat medics who want to become surgeons, people who know what it means to operate under impossible conditions." Done. Maya took a deep breath, let it out slowly. 3 years of running, 3 years of hiding, 3 years of believing she wasn't worthy of the skills she'd earned. "Then I accept." The room erupted. Tommy smiled. Chen nodded with respect. Whitmore extended his hand. Caldwell saluted. Maya returned it. Muscle memory. The gesture she'd thought she'd never make again. "Welcome back, Major," Caldwell said. "Doctor," Maya corrected. "I'm a doctor now." "You were always both." On the table, David Chen's heart beat steady and strong. Alive because someone had stopped running from who they were meant to be. 6 weeks later, the hospital looked different. Not physically. The same walls, the same floors, the same fluorescent lights humming overhead. But the rhythm had changed. Maya stood in the new trauma simulation lab on the 4th floor, a space that hadn't existed 2 months ago. Now it held 4 full surgical bays, complete monitoring equipment, and simulation mannequins programmed for every combat injury pattern the military database contained. 15 people stood in front of her. Veterans, former combat medics, Navy corpsmen, Army 68 Whiskies, 1 former Air Force PJ. Ages ranging from 26 to 42. All of them had saved lives in war zones. None of them had credentials for civilian medicine. Until now. "This program is accelerated," Maya said. Her voice carried the same calm authority it always had. 18 months instead of the standard residency timeline. You'll work harder than you've ever worked. The failure rate in traditional programs is 12%. Ours will be higher. Not because the standards are unfair, but because we're compressing years of training into months. She walked along the line, made eye contact with each person. "You have experience no civilian resident will ever have. You've operated in darkness, under fire, with limited supplies. You've made life and death decisions in seconds. That experience is valuable, but it's not enough." She stopped in front of a woman, 31 years old, former Navy corpsman, 3 deployments, scars on her hands from shrapnel. "What's your name?" "Sarah Mitchell." "Why are you here, Mitchell?" "Because I'm tired of people dying when they don't have to." Her voice was steady. I'm tired of watching civilian medics hesitate when someone needs immediate intervention. I want to be the surgeon who doesn't hesitate. Maya nodded, moved to the next person, male, late 20s, haunted eyes. Name? James Park, former Army medic, 2 tours Iraq, 1 Afghanistan. Why are you here? Park's jaw tightened. Because I can't stop seeing the ones I couldn't save. I figure if I'm going to see them anyway, I should get good enough that there are fewer of them. The honesty was brutal. Maya recognized it, the same reason she'd pushed herself for 8 years. Good answer, she said quietly. Dr. Whitmore entered through the back door, watched from a distance. In the past 6 weeks, he'd transformed from skeptic to Maya's strongest advocate. The hospital board had questioned the accelerated program. Whitmore had fought for it. 1. Maya moved to the center of the room. Traditional medical training teaches you to follow protocols, to consult, to cover yourself legally. That training has value, but it also creates hesitation. And hesitation kills patients. She pulled up an image on the overhead screen. Chest X-ray. Tension pneumothorax. Civilian protocol says confirm with imaging before intervention. Combat protocol says treat the symptoms immediately. In this program, you'll learn both. And you'll learn when to choose which approach. Another image. Cardiac tamponade. Traditional approach waits for ultrasound confirmation. Combat approach recognizes Beck's triad and acts. You'll learn to read the patient, not just the machines. She advanced to the next slide. Showed a surgical field. Complex vascular injury. You'll also learn precision. Combat medicine is about saving lives at any cost. Civilian medicine is about saving lives with minimal collateral damage. The techniques are different. The mindset is different. You need both. Sarah Mitchell raised her hand. How do we balance them? When do we know which approach to use? Experience, pattern recognition, and the willingness to make the call, even when you're not certain. Maya's voice was firm. You'll make mistakes. Accept that now. The goal isn't perfection. It's continuous improvement and maximum survival rates. She looked around the room, saw the mix of determination and fear in their faces. 6 weeks ago, I was hiding who I was. Pretending my combat experience was something to bury instead of build on. I was wrong. Your military background isn't a deficit, it's your foundation. We're going to build a medical education on top of it that makes you the most effective trauma surgeons in the country. Tommy Rodriguez entered with equipment carts. He'd become Maya's primary assistant, former Army medic who understood exactly what she was trying to create. First exercise, Maya said, simulated mass casualty. 4 patients, various injuries. You have 12 minutes. Prioritize, treat, end. Stabilize, begin. The room exploded into controlled chaos. Maya watched, assessed, made notes. Mitchell moved to the most critical patient first. Good instinct. Park hesitated, checked vitals on multiple patients before committing. Understandable, but problematic. The former PJ, named Rodriguez, started barking orders like he was still coordinating a rescue. Leadership skills, but needed to learn collaborative medicine. Whitmore moved beside Maya. They're rough. They're raw. There's a difference. Will they make it? Most of them, the ones who don't quit when it gets hard. On the floor, Sarah Mitchell was performing a needle decompression on the simulation mannequin. Her hands were steady. Her voice was calm as she called out vital signs to her team. She's good, Whitmore observed. She will be, Maya corrected. She's not there yet. The 12 minutes ended. Maya called time. 3 of the 4 simulated patients survived. 1 died because the team spent too long on diagnostic assessment instead of treating obvious symptoms. Gather around, Maya said. The 15 veterans clustered close, sweating, exhausted, frustrated. You lost a patient. Why? Silence. Park, you were team lead. Tell me why your patient died. James Park's face was tight. We spent 90 seconds confirming internal bleeding instead of starting transfusion protocol immediately. Why did you do that? Because I wanted to be certain before committing resources. Wrong answer. Maya's voice wasn't harsh, just factual. In combat, you treat the most likely cause immediately. Confirmation comes after intervention. Your patient bled out while you were being careful. Park nodded slowly. The lesson landing. Run it again, Maya said. Different scenario, same time limit. Don't make the same mistake twice. They ran 8 scenarios that first day. Veterans improved with each iteration, muscle memory returning, combat instincts resurfacing, the gap between military experience and civilian application starting to close. At 1800 hours, Maya called the session. Tomorrow, 0600. Be ready for surgical practicals. Dismissed. The group filed out, exhausted but energized. Sarah Mitchell lingered. Dr. Reeves, can I ask you something? Go ahead. How did you handle it? The transition from combat to civilian medicine? Because I feel like I'm two different people and I don't know how to reconcile them. Maya was quiet for a moment, recognized the question. She'd asked herself the same thing for 3 years. You don't reconcile them, she said finally. You integrate them. The combat medic and the civilian surgeon aren't separate identities. They're both you. Different contexts, same core purpose. But civilian doctors look at me like I'm damaged, like my experience is a liability instead of an asset. Some will always think that. Ignore them. Focus on the ones who recognize that you bring something unique. Maya gestured around the simulation lab. This program exists because combat medicine has value in civilian settings. You just have to find the right place to apply it. Mitchell nodded, started to leave, stopped. Thank you for creating this, for giving us a path forward. Thank you for having the courage to take it. After Mitchell left, Whitmore approached. The board wants to expand the program, national recruitment, federal funding from the VA. They're calling it the Reeves Protocol. Maya shook her head. Don't name it after me. You built it. We're building it. This isn't about me. It's about creating a pathway for veterans who have skills the medical system desperately needs. The president called this morning. Whitmore's voice carried a note of pride. He's fully recovered. Wants to visit the program. Do a press conference about veteran healthcare initiatives. Maya's jaw tightened. I don't do press conferences. You saved his life. You can't avoid recognition forever. Watch me. Whitmore smiled. You're stubborn. I'm focused. There's a difference. Her pager went off. Trauma alert. Multi-vehicle collision. All available staff to emergency. Maya was already moving toward the door. Aren't you off shift? Whitmore called after her. Trauma doesn't take shifts. She disappeared into the stairwell. Whitmore watched her go. Dr. Lisa Park appeared from the observation room. She'd been watching the training session. Her expression had changed over the past 6 weeks. Less resentment, more respect. She's different now, Lisa said. She's herself now, Whitmore corrected. There's a difference. In the emergency department, Maya pushed through the doors. The familiar organized chaos, the sound of monitors and urgent voices. A gurney crashed through the ambulance bay. Critical patient. Massive trauma. Maya assessed in 2 seconds, made the call, started giving orders. A team moved around her, responding to her authority, her certainty. 6 weeks ago, she'd been a second-year resident trying to hide. Now she was exactly who she was always meant to be, a surgeon who didn't hesitate. A leader who didn't question her instincts. A veteran who'd finally stopped running from the skills that defined her. The patient stabilized under her hands. Vital signs improved. The crisis passed. Maya stepped back, let the team continue. Tommy caught her eye from across the room, gave her a slight nod. She nodded back. No words needed. Just the quiet acknowledgement between two people who understood what it meant to save a life. And the commitment to keep doing it. No matter how hard it got. 6 months after Maya accepted the position, Metropolitan General Hospital had become something different. The trauma survival rate had increased by 31%. The hospital had treated 47 military personnel who specifically requested transfer because they'd heard about the veteran surgeons on staff. The Reeves Protocol, despite Maya's objections to the name, was being studied by 17 hospitals nationwide. Maya stood in the main conference room. Behind her, a screen displayed statistics. Survival rates, complication percentages, patient outcomes, numbers that represented lives saved. In front of her sat representatives from the Department of Defense, the Department of Veterans Affairs, FEMA, and 3 international medical organizations. She hated presentations, but this one mattered. The traditional medical education model takes 12 years, Maya said. 4 years undergraduate, 4 years medical school, 4 years residency minimum. That timeline creates excellent physicians, but it also creates a bottleneck. We don't have enough trauma surgeons, especially not ones trained for mass casualty events. She advanced the slide. showed the veteran training program statistics. Combat medics complete their training in 6 months to a year. They perform under impossible conditions, high stress, limited resources, life or death decisions in seconds. Then they leave military service, and that experience is largely wasted because civilian medicine doesn't have a streamlined pathway for them. General Caldwell sat in the front row. She'd become a regular visitor, advisor to the program, advocate in Washington. The accelerated program we've developed bridges that gap, Maya continued. 18 months, intensive training that builds on existing combat experience. We're not teaching them how to stay calm under pressure. They already know that. We're teaching them precision, civilian standards, how to apply their field experience in controlled environments. She pulled up a video, surgical footage from the simulation lab. Sarah Mitchell performing a complex vascular repair. Smooth, confident, perfect technique. Mitchell was a Navy corpsman 6 months ago. Now she's performing surgeries at a third-year resident level. In another year, she'll be ready for independent practice. We've compressed the timeline without compromising quality. A man in the back raised his hand. Department of Defense representative. What's the failure rate? 22% don't complete the program. Murmurs around the room. That was high. Why so many? Someone asked. Because we maintain the same standards as traditional residencies while compressing the timeline. It's brutal. Deliberately so. The ones who complete it are exceptional. Maya's voice was firm. We're not lowering standards. We're intensifying training for people who already have the foundational experience. She advanced to the next slide. Patient testimonials. David Chen, the teenager from the car accident, standing with his soccer team, fully recovered. Margaret Chen, the gallbladder patient from Maya's first day, healthy, no complications. President James Bradford, back to full duties, cardiac function normal. These people are alive because of aggressive intervention by surgeons who didn't hesitate, Maya said. That's what combat training provides, the willingness to act decisively when seconds matter. She clicked to the final slide. Projected expansion plans. We're proposing a national network, 20 hospitals, each with a veteran surgical training program, coordinated curriculum, shared resources. Within 5 years, we could add 500 trauma surgeons to the workforce. Surgeons specifically trained for mass casualty events, natural disasters, and crisis medicine. The VA representative leaned forward. Cost? Federal funding through VA medical education programs. Estimated $12 million annually, but the return is significant. Each surgeon we train will save an estimated 200 additional lives over their career compared to standard care timelines. Whitmore stood from his seat beside Maya. Metropolitan General is committed to hosting the flagship program. We've already allocated space and resources. Dr. Reeves has built something extraordinary here. We're ready to scale it. The room was silent, people taking notes, exchanging glances. The Department of Defense representative stood. I'll recommend full support. This addresses multiple issues simultaneously: veteran employment, healthcare workforce shortage, emergency preparedness. It's elegant. Others nodded. The momentum was building. Maya felt something unfamiliar. Hope. The meeting ended with commitments to move forward, funding applications, site visits, timeline development. As the room emptied, General Caldwell approached. You did good, Major. Doctor, Maya corrected with a slight smile. Old habits. Caldwell handed her a folder. This came through official channels. Thought you'd want to see it. Maya opened it. Letters, dozens of them, from soldiers she'd operated on. From families of patients she'd saved, from combat medics who'd trained under her. One letter was from Rodriguez, the soldier from Kandahar, the one who'd died while she was operating on someone else. Except it wasn't from him. It was from his mother. Maya read it slowly. The letter thanked her, said that Rodriguez had written about her in his final letters home, had told his mother about the surgeon who never gave up, who fought for every life like it was the only one that mattered. His mother wrote that she didn't blame Maya, that her son had died doing what he believed in, that she was proud he'd served with people like Maya. The letter ended with a single line. He would want you to keep saving lives. Please don't stop because you couldn't save his. Maya's hands were shaking. Caldwell put a hand on her shoulder. You carried guilt that wasn't yours. But you can carry their legacy forward. That's the choice. Maya folded the letter carefully, put it in her pocket. Thank you for bringing this. Thank you for building something that matters. After Caldwell left, Maya walked through the hospital. 4th floor. Past the simulation lab, where tomorrow's session was already set up. Past the resident lounge, where her program participants studied late into the night. She took the stairs down to emergency, her natural habitat. Tommy was at the nurse's station, looked up when she approached. Heard the presentation went well. It did. National program, that's big. It's necessary. He studied her face. You okay? You look like you got hit with something heavy. Maya pulled out the letter, showed him. Tommy read it, handed it back carefully. That's a gift, he said quietly. Permission to stop punishing yourself. I know. Do you accept it? Maya was quiet for a moment, looked around the emergency department. At the organized chaos, at the patients being treated, at the residents learning, at the lives being saved every single day. I'm trying. That's all any of us can do. The ambulance bay doors opened. Paramedics rushed in with a critical patient. Major trauma. The familiar call that made Maya's instincts sharpen. She moved toward the trauma bay. Tommy followed. Dr. Lisa Park was already there. 6 months of working alongside Maya had transformed her. Less ego, more confidence. She looked up as Maya entered. Motorcycle accident, head trauma, internal injuries. He's critical. Maya assessed the patient in 3 seconds. Get me a CT scan. Prep OR2. Call neuro for consult. Move. The team responded instantly. No hesitation, no questioning. This was what she'd built. Not just a program, a culture. A place where decisive action saved lives. Sarah Mitchell appeared in scrubs. She was on her surgical rotation now. Advanced faster than any resident in the program. Dr. Reeves, need assistance? Scrub in. You're taking lead on the abdominal exploration. Mitchell's eyes widened. Lead? You're ready. I'll supervise, but your hands, your decisions. Pride and fear crossed Mitchell's face, then determination. Yes, ma'am. They moved to the OR. The patient stabilized, prepped. The surgical team assembled with practiced efficiency. Maya stood beside Mitchell at the table, watched her make the first incision, watched her hands move with confidence earned through 6 months of intensive training and years of combat experience. Good, Maya said quietly. Steady pressure. Control your field. Mitchell worked, made the right calls, identified the injuries, began the repairs. Maya provided guidance, but let Mitchell lead. This was the point. Training the next generation. Passing forward the skills and the commitment and the refusal to give up. An hour later, the patient was stable, closed, heading to ICU with good prognosis. Mitchell stripped off her gloves. Her hands were shaking now, adrenaline wearing off. That was incredible, she said. I've never felt so alive and terrified simultaneously. Maya smiled. Welcome to trauma surgery. Is it always like this? The good days are. They walked out of the OR together. Maya felt something she hadn't felt in 3 years. Peace. Not because the guilt was gone, but because she'd found a way to honor the losses by preventing future ones. In the surgical lounge, James Park was reviewing case files, preparing for tomorrow. He looked up as they entered. Heard Mitchell got her first lead surgery. How'd it go? Patient's alive, Mitchell said. That's how it went. That's how it always needs to go, Maya added. Her pager went off. Not a trauma alert, a different code. She recognized it. Presidential visit. She'd been avoiding this for 6 months. But apparently, it was happening now. Tommy appeared in the doorway. President's here, wants to see you. Security's already locked down the 4th floor. Maya sighed. Can I refuse? You saved his life. Probably not. She walked to the 4th floor conference room. Secret Service agents lined the hallway. Agent Chen stood outside the door. Major Reeves, he said with a slight smile. Agent Chen. He's been asking about you for months. Wanted to come sooner, but you kept declining. I don't like publicity. He's not here for publicity. He's here to say thank you. Chen opened the door. President Bradford stood inside, looking healthy, strong, fully recovered. He turned as Maya entered. Dr. Reeves, finally. Mr. President, I've been trying to meet with you for half a year. You're very good at avoiding people. I'm better at surgery than politics. He laughed. I noticed. That's why you're still alive. He gestured to the chairs. They sat. I wanted to thank you personally, Bradford said. Not as president. As the man whose life you saved. I have 2 daughters, 4 grandchildren. I get to see them grow up, because you refused to let me die. Maya nodded, didn't know what to say. I also wanted to tell you that the federal funding for your program is approved. 20 hospitals, full support. You've built something that's going to save thousands of lives. We've built it, Maya corrected. It's not just me. It started with you, with your willingness to step forward when everyone else hesitated. He leaned forward. That's leadership. That's courage. That's what this country needs. I just did my job. No, you did everyone else's job too, and you did it better than they could have. He stood, extended his hand. Thank you, Dr. Reeves, for my life, and for everything you're building here. Maya shook his hand. You're welcome, Mr. President. After he left, Maya stood alone in the conference room, looked out the window at the city below, at the ambulances arriving, at the constant flow of people needing help. She thought about Kandahar, about Rodriguez and Jackson and Kim, about the 3 lives she couldn't save, and about the hundreds she had saved, and the thousands more that would be saved by the surgeons she was training. The guilt would always be there, part of her, but it didn't define her anymore. What defined her was the choice to keep fighting, to keep teaching, to keep refusing to give up when everyone else said it was over. Her pager went off again. Trauma alert. Maya smiled slightly, turned away from the window, and walked toward the emergency that was waiting. Because that's what she did. That's who she was. Dr. Maya Reeves, combat surgeon, trauma chief, teacher, the woman who turned fear into focus, guilt into purpose, and loss into a legacy of lives saved. The journey continued, and she was exactly where she was meant to be.